Well, hello there. Hi, Chrysanthe.
Hello, Mello.
How you doing?
You haven't aged a day since college.
Oh,
You look
you,
the same.
I can say the same about you. Well, yeah, I'm so excited you're here because, um, like I don't think we've talked with a health policy person in the show yet, and so you'd be our first person. Um, and you've been in this field for about 20 years, right? So it's
Yes.
a really long time. Uh, and I guess I'm just curious about like how you got started in being in health policy. Is it something you did in college and I didn't know about it?
Sort of, sort of. I think, I come from a pretty traditional Greek family who, is very motivated, very driven. So from a very young age, I think I wanted or aspired to be a doctor. And then I was accepted to Mount Holyoke and I was on a pre-med track and I took Lynn Morgan's medical anthropology class and it really sort of changed my life in the best of ways because at the time my uncle who I was very close to who lived outside of Boston um, had pancreatic cancer and he had passed away and um, I think that the way she talked about the intersectionality between public health and economics and policy um, really inspired me to go to her office. She was my advisor, one of my advisors, and I said, I want to create my own major. And she was like, well, why don't you just do the public health certificate that we have across the five colleges? And I said, because I'm not really as interested in every aspect of the certificate. I'm only interested in more of the health policy portion of it. Um, and so I created a major called critical medical anthropology, and it really combined my interest in economics, politics, and anthropology. And from that, for my senior thesis, I wrote a thesis on, it was called Shooting Up the Stereotypes, and it basically explored the effectiveness of needle exchange programs as they related to the transmission of HIV/AIDS in Western Massachusetts. And for that project, I collected both quantitative and qualitative data. I interviewed mayors of Chicopee, Springfield, Holyoke. I interviewed over 20 people, former injecting drug users, and I analyzed and all of that data and wrote, my thesis from that. And I realized in that moment of sort of independent study that I really thrived in that type of space where I got to talk to people and really felt like I was educating people about at the time and even today, a very taboo, a very stigmatized topic, you know, because there's a certain stigma, there's certain stereotype of people who are, addicts. And from my experience, that those stereotypes are the furthest of what's really the truth of those people. Um, and it really inspired me, I think, to sort of shift my career aspirations from medical school to more public health and policy. And that's when I decided to go to Italy for my graduate degree in um, international health policy management and economics. And then I moved to DC in 2005. So I'll be celebrating 20 years in
Wow.
in DC in June. And I started my career as an unpaid graduate intern for Dr. Fran Murphy, who at the time was the Undersecretary for Health Policy Coordination at VA. And and you know, she really focused on making me realize what it takes to, draft policy, to actually implement policy. And, to this day, she's probably one of the most respected female leaders or leaders in general in government that I've seen, in my years in DC,
Wow.
because of the just her integrity and the genuine way she approaches very challenging topics around, veteran healthcare access, veteran mental health um, access to services, etc. And
Is that what is that the kind of policy that you were working on like after you moved to DC or working with veterans and the military?
um, I've worked on a number of different policy areas in uh, both veterans and military health, um, including even um, a relatively short stint as a project manager for an Afghanistan reach back project, which actually enabled me to travel with my team, with my boss, Dr. Holloman, to Afghanistan twice.
Oh,
One was just a very relatively short trip. I think it was 2 or 3 weeks to collect sort of baseline data on healthcare access and quality among Afghanistan's military, police, and just public healthcare systems. And we were able to then go back to Afghanistan again in 2008. So our initial trip was in 2007. Our second trip was in 2008. And after that trip, we actually drafted a strategic plan of sorts that highlighted our findings from both the qualitative and quantitative data aspects.
wow. That is really impressive. I'm just thinking about when you went on these, it sounds like research, evidence collecting excursions, right, in the field. Did and you mentioned you also collected qualitative data.
Mhm.
Did you have to speak with the locals? And I'm just wondering, like, if you had to learn the language, that they spoke there.
Well, actually, we traveled with interpreters, which was helpful. So we didn't necessarily have to learn the language, but we met with, I wouldn't necessarily, actually, we did conduct a couple of volunteer missions where we brought shoes and certain just basic needs to some of these refugee type camps that were around the city in Afghanistan. But um, our days were mostly focused on meeting with the Surgeon General or the Dean of the medical school and his staff, or the Minister of Police, or the Minister of Defense, or the Minister of Health. And then also, collaborating with um, the command surgeon that we worked for, in Afghanistan, as well as the State Department officials that we collaborated with as well. So
Wow.
it wasn't as I, it wasn't as though we were going house to house collect. It was more, at a leadership level.
Oh, wow. Okay. Oh, that's really interesting. S- I feel like not a lot of people get an opportunity to do something like that. Um, and so this was your work with the VA. I know eventually.
Well, this was more my work. It was called the Center for Disaster and Humanitarian Assistance Medicine. It was a think tank under DOD's military medical school, USIS at the time. But yeah, and that was right before I joined Booz Allen. So that was my next sort of experience or adventure, career adventure was joining Booz Allen.
Okay, so quick question, because I know you went to law school. Was
Yeah,
this like, did all of these things happen before or after you went to law school?
before.
Before. Oh,
Yeah,
okay.
I didn't go to law school until 2011. So that was about 3.5 years or so after I joined Booz Allen.
Okay. And again, like you were doing health policy. What inspired you to go into the legal field?
I never, as much as my mom would say, "Oh, I want you to become the next Judge Judy," I was like, I don't see myself like that, Mom. But she would say those funny things from time to time. I think I have several cousins who are lawyers, and um, I thought that having a law degree or that type of education would be so um, valuable when it comes to continuing to add that aspect of analysis to a policy or to, the healthcare field in general, just knowing sort of the legalities around and the regulations and compliance aspects of health policy, because it's one thing to think about a policy that you may think will be very effective, but is it is it legal? Is it constitutional? Like I didn't have that type of knowledge that I felt would just be so valuable, as I said, moving forward to where I wanted or where I saw myself, I guess, saw my career going.
Wow. Wow, that's incredible. And so I know we've mentioned that you've been doing health policy for 20 years, even getting a law degree to even boost your knowledge. And so you've navigated the health policy field from a professional standpoint.
Mhm.
Um, but recently, you actually became a foster parent and eventually adopted your foster child.
Yeah,
This
my
is
baby
awesome.
Jay. Yeah.
Baby J, yeah. And and now you're navigating the health policy field or the health system in a totally different context, right?
Mhm.
Can you tell us more about this personal aspect of you navigating health policy?
Yeah. Happy to. I think as we were discussing earlier, I think I'm, my mother's daughter. I think I'm a caretaker at heart. If you, um, um, what was I gonna say? Sorry. Um, I think when my mom, let's back up a little bit and then we'll get into the how I became a foster parent. When my mom moved here in 2012, I called
To
it
DC, right?
her, yeah, to DC for Massachusetts. Um I she was relatively young. I think she was um like 63, she was relatively young. And she was a breast cancer survivor. And I never saw it. People, some of my friends said, well, how is this going to affect your dating life? And I was like, I don't have much of one, so not much, you know. And if I do end up meeting someone and they don't want my mom in the picture, then that's not the right person for me anyway, you know. Um, but then about 5 years after she moved here, um, um, she was complaining about sort of pain in her chest area and was diagnosed with a recurrence of breast cancer. And that was, 13 and a half or so years after her initial diagnosis. So I think we all felt like, she was in the clear. And so it was pretty shocking when it happened. But it was also, as I said, 13 or so years later. And so breast cancer treatments had come a long way. And she really, had the best of care. But I think I saw my role with given my health policy background and health knowledge to be that advocate for her to make sure I didn't care if she was on Medicare or not, or if the supplemental was going to cover it, it was going to cover it because my mom deserved the best, deserved the most cutting edge treatments. And so I think um, that's when my the my professional knowledge of healthcare and really became much more personal. And now with baby J, it's taken to another level. So after my mom passed away, I felt a bit empty in the sense, not only by the loss of my mom, but also because, I was on this mission of being this caretaker and advocate. And then,
Yeah,
you know,
that's your life's purpose, it sounds like.
I mean, in a way,
I mean, it
yes.
like it drives you. Like it
Yeah,
drives you to help people. That's what it sounds like.
yeah, it does. I mean, it's and my dad used to say it's a lot easier to be kind than to be unkind or to be mean. So it's better to be kind, and that's how I try to be, every day. Um,
More people are like you.
I think there are more people, but like as my best friend and your one of your friends, Shintoba says, the majority of people are not that way, unfortunately.
Yeah.
Um,
Sorry, I didn't mean to cut you off.
no, it's okay. It's okay. So basically, um, I want to say 2 or 3 years later, a friend of mine was becoming a foster parent in New Jersey, and she started talking about it. And I had never really, considered fostering, just because I thought, I was in my early to mid 30s at some point, and I said, well, I'm going to meet someone and I'm going to have a child. Like I always knew I wanted to be a mom. Um, but I always envisioned, given I think my upbringing as well, that it would be more quote unquote traditional, and then at 38 or 39, I said, I still want to be a mom. I haven't met anyone. And and um, I'm going to look into this. And funny enough, another friend of mine started working at a nonprofit. And at this nonprofit, um, they had uh, a foster training, basically, that it wasn't through DC's CFSA. They had a partnership with them. It was called the Latin American Youth Center, LAYC. And so
CFSA, I'm sorry.
Latin American Youth Center.
That's CFSA.
No, oh, CFSA is the Children and Family Services Agency for DC.
Oh, okay. Okay, thank you. Sorry.
Sorry, sorry. So, in any case, um, the manager who was sort of leading recruiting of the foster parents. We met and she virtually, and she showed me a presentation where there were 15,000 children in foster care at that point or
Oh,
something to
in
that effect.
DC?
In DC, yeah. And I saw it and I sort of like I had to take a double take basically because I thought that was I think I asked her, is that right? Like, is that possible? Like what is this? And so instantaneously I felt like I could at least take one or two or three children because if I can play some sort of role, well, that's better than nothing, you know. Um and so I completed the initial training and had home visits so that they could all these the criteria that it takes, I guess, to become a foster parent, which is not necessarily a simple task, so to speak. um, and I became a licensed foster parent in July of 2021, and I went on vacation in August to visit our mutual friend Shintoba in the South. We called it our, what did we call it? Our South uh, Adventure. I don't know. It was a better name that I'm remembering. Southern Adventure. I don't know. And I got a call from LAYC that there were two siblings. One was 4 and the other was 6 at the time. Would you be interested in taking them? And I said, well, yes, but I'm on vacation, but I'm coming back soon, so I'll reconnect as soon as I get back.
Yeah.
When I get back, they said, "Oh, the 4 and 6 year old have been placed with a Spanish speaking couple," which actually wasn't true at the time, but that's another story. Would you be interested in taking the older sister and her baby? And I said, well, I specified that my preferred age range was 7 to 11. So, teen, a 15-year-old and a 6 month old baby is not necessarily the criteria, but let me just go to the hospital. And because my daughter had heart surgery to repair basically a hole in her heart. It's called a PDA.
Oh, wow.
She was still at Children's, and I went in. This was like September 20th, I think, of 2021. And um I looked at her, and this was before her birth mom, who's also my foster daughter for about 9 months or so, had come to the hospital because we were meeting each other. And I just looked at her, and she had just gotten up from a nap or something, and she, her head was a little swollen, and you could tell that she was still recovering from this heart surgery, and she was on 6 different medications
Wow.
and so on and so forth. And something in me just said, I don't know what the future holds, but I'm gonna try my best to nurse, quote unquote, nurse this child back to health. Like, I'm at least going to put her in a position where she's put on sort of a healthier track. And if she, ends up being reunified with her birth family, if there's a kinship relative that comes into the picture down the line, that's what's meant to happen. But right now, as long as this child is under my care, I'm going to just do everything I can for her. Um, and very quickly after her birth mom came to live with me as well, it was evident pretty early on that her birth mom wouldn't necessarily be able to care for her and provide for her, especially when it comes to the medications and different health specialists and so on and so forth. And so basically, uh, after her, shortly after her first birthday, around her birth mom's birthday in 2022, her birth mom left and moved to, in with an aunt in New York. And relatively shortly thereafter, the goal was changed from reunification to adoption. Um, and but that in itself also takes time because basically when it comes to fostering, uh, um, I'm sorry, Mello, there's
Oh, no, it's okay. I know this is like this is like pretty heavy.
um,
You have a really kind heart, like you have a really big heart. 'Cause
oh, thank you. I appreciate, but
and
it
this while
doesn't,
you were working, right? Like you were still working the whole time. You were working full
yes,
time the
yeah.
whole.
And I started a new job that was based in Canton, Mass, that required some travel a week before baby J came into my care. So a
No.
lot of things were happening. That's the story of my life. It's like balancing all of these things all at once. One of my best friends, who from childhood, said, I've never known you, and we've known each other since we were 12. She's like, I've never known you not to be stressed or not to be overcommitted. And I'm like, even when we were 12, she was like, yeah, even when, oh my God, I was really stress muffin, I guess. Um,
Were you also, I know you, at some point, you were also a public official, right? You were elected into your local government. Was this also while you were fostering?
yeah, actually, yes. No,
It's like overachievers anonymous here.
type A, yeah, overachieve, yeah, I'm tired, not joking. No, I actually ran uh 3 times. I always say it's the third time's the charm, but I ran 3 times to be an advisory neighborhood commissioner in DC, which is basically an extension of the council members' staff. So I was one of the four Ward 4 ANC commissioners, and it's a 2-year term. So my term just ended. But yeah, that so I think that brings up a good point, which is it does take a village, like Jennifer, baby J. Uh, she would not be as strong and um, so I think as a strong-minded, physically strong without the village. Like I call them my village. My neighbor up the street who was basically my right-hand person for almost 2 years with her. Um, and her honorary yaya now, who was always willing um, to take care of her during my ANC meetings. And, so
What's
it does,
ANC?
what?
What's
Oh,
ANC?
advisory neighborhood commissioner meetings.
Sorry. And you're
Um,
still DC, all the
yeah,
acronyms.
sorry. I mean, yeah.
No, I mean yeah, I didn't mean to uh make you share something that's like super heavy or anything?
Oh, it's so fast forward, I guess, and we can go back into the details, but I think I went into a little bit of what it takes to become a foster parent, etc. But fast forward to maybe the night before adoption. So our adoption took place November 9th of 2023. I I guess I'm superstitious. So I just had read so many stories about how sometimes kinship relatives come out of the woodwork like days before an adoption is supposed to be finalized. So I didn't really send out an invite for the virtual Zoom for people to zoom in to the adoption until literally, I think, 10 or 11 at night, the night before. Um, but, you know, um, the judge for this case started off by saying, we weren't even, and I knew this, but she said we weren't even sure baby Jay would make it, um, given her heart condition and so on and so forth. And she said the moment that she was placed in my care, she knew, the judge knew that she would be okay. And that really meant a lot, coming from her, and because she knew the whole situation, the whole family dynamic, etc. And I think from very early on, um I felt that she was my daughter, but when you adopt her, when I adopted her, it's just on another level of that, like, commitment and focus and drive to ensure that she just continues to grow, and that we address any of her physical and neuro developmental needs that may happen. You know, I
Wow.
think you have to approach. I'm a big believer in fate, and I've always felt that my mom really brought my daughter to me, that I wouldn't have been able to adopt her if that's not what my mom thought would be best for me. Um, and I gave my daughter my mom's name as her middle name because I really want her to be a part of baby J as she grows up. But I think parenting, especially parenting a child with certain special needs, whether physical, developmental, etc., um, isn't um, isn't easy. Parenting's hard in general, but like the challenges that you don't necessarily control even um, are not easy. But I think you just have to have faith that it's going to work out the way it's meant to work out. And it's been a journey, but I think that it's really reaffirmed to me also, like, all of this knowledge and things that I've done professionally pale in comparison to the the motivation that I feel for, making sure baby J gets the education services she needs to thrive, and the social services that she needs to thrive. And it's also made me realize that I do potentially want to pass the bar exam and become an education disability advocate because, especially in these times where that's, we're needed, to make sure that we're advocating for those where, you can't take for granted the services that my daughter or many other children are receiving when they're talking about dismantling the Department of Education and so on and so forth. So we just have to remain vigilant and understand that empathy is sort of the key to ensuring that we have this understanding that there's not many people in this country who aren't living paycheck to paycheck. It's, the majority of us are. And, there's millions probably children with special needs in this country who have access to public education, who are contributing to society and and they don't fit into a mold, and that's okay because I don't think any of us really do.
Wow. You make me cry, Chrysanthe.
I didn't mean to do that, Mello. Come on now.
No, no, wow. I, are you running for office? Are you trying to make an announcement right now? What-
Maybe someday. Maybe I'll keep you posted. You can be my campaign manager.
Yeah, no, but thank you. Thank you for, sharing your professional and very personal experiences and really your reflections on how this all ties in together. And um, yeah, I didn't know there's 15,000 kids in DC who need foster homes. And I'm sure this is also everywhere is probably even more, right? Because DC is a fairly small city,
Mhm.
land land mass wise. Yeah, I mean, hopefully you can inspire someone out there to consider fostering and also advocating for children with like special medical needs.
Yeah.
Yeah. Well, I want to thank you again, and I
Thank you for
you.
this opportunity.
Yeah, no.
Not announcing anything right now.
Yeah. Oh, stay.
Talk to me in like, 4 years or something.
Okay. Yeah. Well, stay amazing and say hi to Baby J.
Thank you. Thank you, Mello.
Okay. Bye.
Bye.